Here are 10 Puerto Rico Medical Board-style clinical vignettes focused on social determinants of health, with 4 answer choices and explanations. Social determinants of health, clinical vignettes. 1. Food insecurity and diabetes management. A 59-year-old woman with type 2 diabetes has poor glycemic control despite multiple medications. She reports skipping meals to afford insulin. What is the most appropriate next step? A. Increase her insulin dose. B. Refer her to a diabetes educator. C. Assess for food insecurity and connect her to community resources. D. Switch her to a continuous glucose monitor. Assess for food insecurity and connect her to community resources. Explanation: food insecurity affects chronic disease management. Clinicians should screen for it and refer patients to food assistance programs. 2. Housing instability and asthma. A 7-year-old boy with persistent asthma presents with frequent nighttime wheezing. His mother reports living in a mold-infested apartment with roaches and poor ventilation. What is the best intervention? A. Increase his inhaled corticosteroid dose. B. Prescribe an antibiotic for possible infection. C. Address housing instability and advocate for improved living conditions. D. Order an allergy test. Answer C. Address housing instability and advocate for improved living conditions. Explanation: poor housing conditions, mold pests worsen asthma. Referrals to housing agencies or tenant advocacy programs can improve health outcomes. 3. Language barriers and health literacy. A 45-year-old man with hypertension misses multiple appointments. He speaks limited English and struggles to understand his medication regimen. What is the best strategy? A. Provide written instructions in English. B. Use a trained medical interpreter. C. Ask his child to translate medical advice. D. Refer him to a literacy program before continuing care. Answer B. Use a trained medical interpreter. Explanation: professional interpreters improve patient understanding, adherence, and outcomes. Family members should not be used as translators due to privacy and accuracy concerns. Transportation barriers and dialysis. A 68-year-old man with end-stage renal disease misses dialysis sessions due to lack of transportation. What is the most effective intervention? A. Discontinue dialysis due to non-adherence. B. Encourage him to take a taxi. C. Connect him to community transportation services. D. Refer him for peritoneal dialysis instead. Answer: C. Connect him to community transportation services. Explanation: lack of transportation leads to missed healthcare visits. Many areas have non-emergency medical transportation programs for dialysis patients. 5. Employment and mental health. A 32-year-old woman with depression reports worsening symptoms after losing her job. She expresses hopelessness about her financial future. What is the best initial step? A. Prescribe an antidepressant. B. Refer her to a job assistance program and mental health services. C. Tell her to focus on self-care. D. Suggests that she take a vacation to relieve stress. Answer: B. Refer her to a job assistance program and mental health services. Explanation: unemployment increases mental health risks. Addressing financial stressors alongside mental health care improves patient outcomes. 6. Racism and cardiovascular health. A 54-year-old Black man with hypertension reports feeling that doctors don't take his symptoms seriously. He is reluctant to continue care. What should the clinician do? A. Reassure him that racism is not a factor in healthcare. B. Encourage him to trust the medical system. C. Acknowledge potential biases and engage in culturally competent care. D. Suggest he see a different doctor. Answer: C. Acknowledge potential biases and engage in culturally competent care. Explanation: historical and systemic racism affect patient trust in healthcare. Acknowledging concerns and ensuring equitable care builds rapport. 7. Health insurance and medication adherence. A 50-year-old man with hyperlipidemia has been off his statin for months due to lack of insurance. What is the most appropriate next step? A. Switch him to a more expensive but effective brand. B. Tell him to pay out of pocket. C. Assist him in applying for medication assistance programs. D. Discontinue treatment due to cost concerns. Answer: C. Assist him in applying for medication assistance programs. Explanation: cost is a major barrier to adherence. Many pharmaceutical companies, state programs, and clinics provide medication assistance. 8. Education level and cancer screening. A 61-year-old woman with low health literacy declines a colonoscopy, saying, "I feel fine, so I don't need one." What is the best approach? A. Respect her decision and do nothing. B. Explain colon cancer risk using simple language and visuals. C. Schedule the procedure without discussing it further. D. Tell her she will regret skipping the test. Answer B. Explain colon cancer risk using simple language and visuals. Explanation. Health literacy affects preventive care. Using simple language, visuals, and teach-back techniques improves patient understanding. 9. Domestic violence and access to care. A 26-year-old woman presents with recurrent bruises and frequent missed appointments. She avoids eye contact and refuses to discuss her home life. What is the best next step? A. Call the police immediately. B. Ask direct but supportive questions about safety at home. C. Ignore the issue unless she brings it up. D. Prescribe an anxiolytic. Answer B. Ask direct but supportive questions about safety at home. Explanation. Screening for intimate partner violence, IPV, in a safe, private setting allows for appropriate referrals and support. Top 10. Environmental hazards and occupational health. A 42-year-old farm worker presents with headache, dizziness, and confusion after working in hot, pesticide-treated fields. What is the likely diagnosis? A. Heat stroke. B. Organophosphate poisoning. C. Migraine. D. Panic attack. Answer. B. Organophosphate poisoning. Explanation. Farm workers face occupational hazards, including pesticide exposure. Prompt recognition and intervention are critical. Key takeaways for social determinants of health. Food insecurity. Screen and refer to food assistance programs. Housing conditions. Poor housing affects asthma and other conditions. Language barriers. Use medical interpreters, not family members. Transportation barriers. Link patients to transport services for medical care. Employment and mental health. Job loss increases depression risk. Racism and healthcare distrust. Acknowledge systemic issues and provide culturally competent care. Health insurance and medication adherence. Help patients find affordable medications. Health literacy. Use simple explanations and visual aids. Domestic violence. Screen in a safe, supportive manner. Occupational hazards. Recognize risks like pesticide exposure. Would you like more vignettes on specific social determinants, such as healthcare access,